We now move on to discussing the management of patients with kidney failure. Alright, several numerous observational studies demonstrate that there is an association between hyperuricemia and the development of kidney disease. Chronic. As early as the year 2000, there have been published studies with a fairly large sample size, 49,000 patients, already showing an association. Thank you. Those patients with uric acid levels higher than 8.5 million per deciliter have an 8-fold increased risk of chronic kidney disease compared to normoracemic patients. This is the direction taken by the challenge posed in the various articles presented after a thorough and detailed examination of the data and results from this comprehensive meta-analysis. And due to the significant findings, we have come to a well-considered decision to undertake a detailed and comprehensive interventional study using the pharmaceutical agent allopurinol. Goicoechea and the rest of the collaborators conducted a clinical trial in which 113 patients were subjected to treatment with 100 milligrams of allopurinol, or continued with their usual care and were followed for 2 years. After the 2 years, they conducted a study on these patients, and they observed a reduction in cardiovascular events. In 71% of cases, there was an increase in glomerular filtration and a reduction in the progression of chronic kidney disease. In 47% of the patients out of those 113 included in the study. However, in 2020, the New England Journal published another article on the same topic, the effects of allopurinol on the progression of kidney disease. Chronic. And this article indeed informs us the opposite. It shows that in fact, in patients with chronic kidney disease and a high risk of progression, treatment with allopurinol did not slow the decline in glomerular filtration rate compared to placebo. Critics of this article argue that it only encompasses a very specific population, those at high risk of progression, and therefore meaning those who present with, an albumin to creatinine ratio greater than 265 and a decrease in glomerular filtration rate of 3 milliliters in the past year. However, due to the discrepancy that exists between studies, we return to a point similar to the previous one, which is that the guidelines recommend treating symptomatic hyperuricemia, but not in patients with kidney disease, chronic. And now, specifically focusing on chronic kidney disease and, in particular, established gout, we'll begin by discussing the management of acute attacks. As we all know, colchicine is contraindicated in cases of severe renal insufficiency, which is defined as the creatinine clearance below 30. However, off-label, colchicine can be used at the lowest dose of 0.5 milaners by extending the dosing interval, administering it every 48 hours instead of the usual 24. We typically use. In cases of moderate renal insufficiency, this practice is already recommended. This is indeed included in the drug's official prescribing information. Therefore, the use of NSAIDs is not recommended for the prophylaxis of new attacks. And in diabetic patients, colchicine may be preferable to NSAIDs and/or corticosteroids. Also, corticotropin, which is marketed as ACTH, has similar efficacy to corticosteroids in this group of patients. Regarding chronic treatment, there are studies showing that febuxostat is superior to allopurinol in cases of kidney disease. Mild to moderate chronic kidney disease. Allopurinol no longer needs to be adjusted based on glomerular filtration rate or creatinine levels. In cases of severe renal insufficiency, the prescribing information recommends using a dose lower than the 100 milligrams per day typically used in healthy patients. Or, for example, you could use that 100 milligram dose, but specifically increasing the interval between doses, such as every 8 hours. The regimen to be used in dialysis is 300 to 400 milligrams of allopurinol administered after each dialysis session. And then there's benzbromarone. Whether at a dose of 50 or 200, it is the uricosuric agent of choice for patients with mild to moderate chronic kidney disease.